Hey, thanks for joining us. Appreciate your coming in. I want to thank all of the folks in this room who care so deeply about the future of mental health services in Vermont. We have an opportunity in Vermont as a result of Irene to ensure that we rebuild this state better than the way Irene found us. That means residents get back into their homes, we get them back so much what they lost, that we grow jobs and economic opportunities by ensuring that Vermont's businesses don't get taken out by Irene. We also have a golden opportunity to ensure that we deliver to Vermont's most vulnerable citizens, our mental health patients in Vermont, the best quality care of any state in the country. We all know that the facility that we were using for the state hospital pre-Irene, the bricks and mortar, did not dignify or allow for quality recovery because the buildings were so dismal. As I've said before, if you took me as a happy, healthy Vermonter and placed me in the old state hospital, the quality of care was extraordinary and the building was so bleak that I would have emerged depressed if I'd gone in happy after 30 days of living there. That's why the federal government condemned the bricks and mortar of the facility. So we have an opportunity now. This administration has been working tirelessly with the extraordinary mental health community in Vermont. Our community providers, our hospitals, our designated agencies, the Brattleboro Retreat, to come together with a plan that will ensure that we deliver quality mental health services to Vermonters for the next 100 years. That's our opportunity, and that's the opportunity that we're seizing today to outline the plan for the future. This is not about bricks and mortar. This is not about politics. This is about coming together, all of us, to ensure that we have one thing in mind. How do we take Vermonters who are struggling with mental health issues and get them quality, preferably community-based care, wraparound services, the support they need to ensure that they have a healthy and happy recovery. That's our goal. As you know, we've worked tirelessly to put together an interim plan given the fact that we had to leave the state hospital on short notice. Let's put it that way. I've made very clear that the opportunity is we will never go back to that facility. We must never go back. So here's the plan that we want to outline to you for the future that will ensure that Vermont is, in fact, the best state in the country to ensure a healthy and quick recovery, good quality care. We will build a 15-bed facility in central Vermont to ensure the good work that we've provided, the good quality care that we've provided by the state of Vermont for those that need intensive inpatient beds. That facility will be built in central Vermont, near Central Vermont Hospital. I'm going to ask the legislature to work together with my administration to get that building up, built, and opened as quickly as possible. We will begin by building a 15-bed facility because that's what we believe we need. However, it will be built and designed on a piece of land that is expandable and can be made larger when necessary or if necessary in the future. Why do we believe that we don't need more than 15 beds now? Because we've come up with a geographic distribution of services that we think will serve Vermont better than the model that we had in the past of one hospital in one location. That is the 15-bed facility that I just mentioned, very close to Central Vermont Hospital. The second is 14 beds provided by the Brattleboro Retreat. We also have entered into a partnership, will be, with Rutland Regional, and I want to thank Tom Huebner for being here today, for 6 permanent beds in Rutland that will serve the Rutland community well, as well as Bennington County and other communities nearby Rutland. We will have up to 5 beds, secure residential beds, on the campus of the Windsor Correctional Facility, which will allow us to serve patients there. That's the plan. 15-bed facility in central Vermont, built as quickly as possible, with expandable potential for the future if and when necessary. 14 beds permanently in Brattleboro, 6 beds permanently in Rutland, and up to 5 beds permanently Windsor Correctional Facility on the beautiful campus there that we have. In terms of dollars and cents, the capital costs for this are roughly $26.6 million. We do believe that we will, with a combination of insurance policy from the Waterbury complex and the help of FEMA in this time of crisis, that some, and under the best scenario, almost all of this build-out could be covered by federal dollars and insurance dollars. Whatever the breakdown is, we must get it done, and we must get it done quickly. Additionally, to ensure that we have the wraparound services, the community care that Vermont has committed to for many, many years, but hasn't always followed through. We're going to have additional, what we call step-down beds, to make sure that we have transitional beds for our most acute care patients. We're going to ensure that we have improved emergency services, and we're going to fund it. We're going to ensure that we have improved individualized services, housing vouchers, and peer services, which are working so well right now in the community care model. So that's the vision. That's the cost. I want to thank our partners, our community care providers, and I'm going to have Floyd Nease speak about for the Vermont Association of Mental Health and Addiction Recovery. I want to thank the Hospital Association, Beatrice Gause, and all of our partners there. And Julie Tessler, is Julie here somewhere? Julie Tessler, thank you for your good work. And to Todd Centybear from Howard Center, we're going to start out by letting Floyd Nease say a few words. Where is he?
Right here.
Thank you. Nice suit. That's the one you got in Taiwan.
This is the second one, yeah. Thank you, Governor. So I'm here today because, as important as it is to say something as an advocate when you find administrations doing something wrong, it's equally important to say something when they're doing something right. The Vermont Association for Mental Health and Addiction Recovery believes that Vermonters with serious mental illness need to be treated as close to home as possible, in the least coercive way possible, and in a way that integrates their mental health care with their physical care. This plan, if executed well, promises to do that. As we go forward, it's going to be important to watch carefully the implementation of the plan. And there are a couple of things that will be sort of the canaries in the coal mine. One of them will be the population, the corrections population of people with serious mental illness, and whether that continues to grow. And another will be the care management system that's put in place. It seems to me that there is no plan going forward that can succeed without a really effective care management plan. And I know the administration is looking at how to do that well. They're looking at other states, and we look forward to monitoring progress as time goes on.
Thank you, Floyd. Who's that next? Beatrice Gause, Hospital Association. Thank you for all your help.
Thank you.
I just want to say a word about the hospitals that I should have mentioned is, in terms of the transition, in terms of the crisis, we've had a lot of partners come up to the plate, but I want to thank the hospitals, Fletcher Allen, Rutland, Central Vermont, for their extraordinary, and all of the others that have been so helpful. Obviously, Brattleboro Treats, one of our hospitals, for their extraordinary cooperation during this transition.
Thank you. Thank you, Governor. I also wanted to thank Governor Shumlin and also his team, Christine and Patrick and Secretary Racine, for their help and assistance from day one. We had been working with them to make sure that patients got the care that they needed under very, very difficult circumstances. We certainly support the Governor's plan. We know that there is a lot of work left to be done. Ultimately, the work that we complete in our mental health system has to become part of our overall health system, and we believe that this work is an integral and very, very important part of our overall healthcare reform efforts. So we're very appreciative of it. And I know that we have Tom Hubner and Rob Simpson and others here who would certainly be happy to add their comments on what they are doing. Thank you.
Julie, Tessler, and then Todd and Rob.
The Vermont Council of Developmental Mental Health Services also appreciates the process of how we got to here. It's been very inclusive, included both peers as well as providers, people who work in the hospitals, individuals involved in the mental health system in all different ways. We also look forward to the dialogue with the legislature because there's a lot to work through still, and it's going to be a very important dialogue coming up. The goal is not just to replace the Vermont State Hospital, but to have a robust public mental health system. Mental health system has three components. The foundation of that is the community-based system. And to have a system that's accessible to the people who need it when they need it. Like healthcare, we want to be able to have people access prevention and primary care. We need that in community mental health. So we need to have peer-based services, outpatient services, case management available for people who need help getting what they need, mobile outreach and crisis teams that can meet people's needs in the community before they go to the emergency room, and a range of residential options. We've gotten a lot of support for that. And importantly, I think we're learning that we can meet the needs of people in community residential options that might previously have gone to inpatient care. Not everyone, but some people, and that's very exciting, and we're really pushing the envelope and learning there. We do need a combination of both community hospitals and a specialized facility, and we do need the care management system that Floyd referenced that makes sure people get to the level of care they need when they need it and have those choices. So you don't want people going to a higher level like inpatient care if they could use a community resource. And as their needs change, you want to help them get to where they need to be. So you put that together and you have an effective system of care, and we're very excited that we're moving in that direction. Thank you.
Thank you, Julie. Todd, you want to add a few words? Thank you.
This plan can be successful. And I won't repeat what others have said, but I applaud the administration and all our community care partners in the hospitals for really taking the risk and pushing the envelope in service of people really who do need care. I'll simply say that ultimately, though, I think the success will not be based on what we finally determine is the right sizing of beds or the robustness of community care organizations. It will really depend upon what someone said who's much more eloquent than I. The question is not can we all but move away from what we have defined in the past as institutional care. The question is really can we find places in our hearts and in our community to serve people and welcome people home. And that ultimately will be the underpinning, I think, of what our success will be as we engage in, no doubt, robust discussion about what those principles are that really undergird the kind of communities that we really want to have in this state.
Thanks, Todd, and thanks for all the great work of the Howard Center. We appreciate it. I want to Rob Simpson from the retreat to say a few words. Before I do, I just want to thank the retreat and our extraordinary state employees for the quality of care that they've been providing in this transition, and I know that they'll provide in the future. When we talk about the state hospital and we talk about the shortfalls there, I want to make clear we're talking about the bricks and mortars of an aging building that should have been moved out of some time ago. We have extraordinary quality care provided by our state employees. I'm proud of the work they do. I'm proud of the work they're doing in a partnership with the retreat right now, and happy to introduce Rob Simpson.
Thank you, Governor. I just want to say from the first night, August 29th, when I greeted the busload of patients from Vermont State Hospital and the employees on the bus, one thing was immediately clear to me, that the phone calls that followed from Todd, Centybear, from the Governor, from Tom Hubner, from Bea Gause, from Christine Oliver, I mean, we have been on the phone and in contact with each other almost daily, multiple people throughout this state. It's absolutely clear to me that the patients are first and foremost in everybody's mind. And I'm delighted to also thank the Vermont State employees who got off that bus, went to work with our employees, and have spent the last 2-3 months with us, helping us understand all the concerns that the state hospital patients had, and have helped us make a more robust system. So I'm very pleased to have the honor and the opportunity to be part of this system and to work with all my partners around the state. So thank you, Governor.
Sure, appreciate all your help.